Hi everyone, I'm back. Today is December the 8th, 2023, exactly 2 years since I underwent the Ravage procedure to correct my Pectus excavatum chest wall deformity. If this is your first time, following my videos, go back a few to catch up on the story so far. So the last time I posted was exactly a year ago. And it really feels like I've come full circle, and this will likely close the chapter on my video updates with my recovery. In the last year, I've really just experienced progressive healing and recovery. A year ago, I still had to be a little bit cautious of, working out. There was some discomfort. I couldn't really sleep on my side or my stomach, and had to just be mindful of certain movements. Even still, because I could definitely feel the change, and it's still taking time to heal. Um, but ever since the last several months, things have just gotten progressively better. At this point, I almost don't even think about it anymore. I'm able to be in the gym, lifting weights. I don't have any limitations. Doing cardio, if anything, I can breathe better. I feel better overall, and I have minimal to no discomfort. Even like what kind of interestingly took a long time to come back is it was like feeling of numbness or just sensitivity around the incision. That has completely come back and feels normal again, so to speak. So I'm still very pleased with how things have turned out. I have zero regrets of undergoing this procedure. I mean, looking back and thinking about my time in the hospital and that initial recovery, and how much that how much I went through at that point. Um, I would do it again if I had to. I feel better. I'm more confident. I have gone shirtless more in the last 2 years than I ever have done, and that just has given me a lot more confidence, with my appearance, and on top of the health, impacts of having more space inside my chest cavity, and better breathing and things like that. So I've come a long way, and I'm grateful for where I've come. And shouting out again the University of Alabama at Birmingham, and Dr. Way, the thoracic surgeon that I partnered with. Um, Phenomenal medical institution. Would recommend them highly for really anything. And so again, glad to have made it this far. I'm just going to show you what it looks like now. It looks very similar to what it did a year ago, but great. Looks fabulous from the front. Minimal scarring still. You really can't tell that. There is still some curvature at the from the side profile view, but that's largely because my curve started from my collarbone down, and the procedure really can only correct the primary area of deformity here towards the bottom middle. So yeah, that's still a little curved, but again, overall, very very nice. I mean, from what it was prior to the surgery, it's a transformational difference. So still very pleased with that. I think what kind of the interesting outcome, as I've kind of worked out a little bit more and have some slightly more muscle mass. I'm definitely no bodybuilder. It's kind of makes that curvature look a little bit more pronounced, but again, just from that front view, and just overall, it looks better. I feel better, and again, I'm very glad to be where I'm at now. After 2 years, it's hard to believe it's been 2 years. Feels like forever, but it also feels like it was just yesterday. So interesting kind of juxtaposition there. But again, shout out to all that have been supporting and following along. I've had some really cool conversations in the comments over the last couple of years of other folks that have been contemplating having their Pectus excavatum corrected, both using the nuts procedure or the Ravitz procedure. Again, always reach out. I'm happy to tell more about my experience, and what has brought me to this point. So it has been a cool thing to see so many folks kind of chime in and be doing their research and wanting to have this done. So, and that was my goal. The whole point of me doing this video series was to showcase where I started and where I ended up, because there's not a lot out there that you can see someone's journey through this type of corrective procedure. So it's been a privilege to do it. I've kind of been outside of my comfort zone, but I hope someone out there has benefited from it, and I have as well. Just kind of being able to see the history of where I've come from and how far I've recovered. So again, I think we're gonna close the chapter on this video blog series of my journey through my Pectus excavatum chest wall deformity correction. And again, very blessed and fortunate to be where I'm at. And thanks for following along.